Welcome back to Catalyst University. My name is Kevin Tokoph, and in this video, we're going to be discussing corrective exercises for temporomandibular dysfunction. Now, when we're talking about corrective exercises here, we're talking about that from a different perspective than how most people on social media are talking about this general term called corrective exercise. You can subscribe to that idea if you want. In this context, we're talking about correcting aberrant mandibular motion. What do I mean by that? Well, let's say you've got a patient that has had capsular restrictions and/or muscle imbalances of the mastication muscles. And what you end up seeing in terms of aberrant mandibular movement is when they open their jaw, open their mouth, their mandible deviates or deflects in some way. So for example, when their jaw opens and it goes off to one side and comes back, that is a deflection. When it goes off to one side, back to the center, and reverses that pattern, that's called a C curve, which is one type of deviation. And then when it goes off to one side, crosses midline, goes to the other, and then to back to center, and then it reverses that pattern, that's called an S curve, and that's the other type of deviation. So deflections and then those two deviations. We're trying to correct for that. So of course, we're targeting the actual impairments, which are stiff joint capsules. We mobilize or manipulate, right? We target muscle imbalances by doing manual releases combined with strengthening other muscles that, when weak, are causing the tight muscles to tighten up as a compensation. But as we start to do those things, and maybe we even start this on the first day, we need to start restoring normal motion to the jaw. Because most people that have had this issue have had it for some time, sometimes a very long time, and they're used to having a motor pattern where the deflection or deviation is normal. We need to correct that. And so that's the idea of these corrective exercises. We are trying to get the jaw moving, that is the mandible, in a straight line down and a straight line up. And there's two exercises that I like to use for this in combination with all the other things that are addressing the specific impairments. One of those is called tongue-limiting mouth opening, and the other is just called guided mouth opening. And both of these you really should do in front of a mirror. Now, the first one, which is tongue-limited or tongue-limiting mouth opening, is basically where you put your tongue on the roof of your mouth, right behind your top row of front teeth. And you keep it there for the duration of the exercise. Now, if I just have my tongue floating willy-nilly in my mouth, and I open my mouth as wide as I can, here's what happens. It goes up to maximum opening. However, if I repeat the same thing, but I keep my tongue placed on the roof of my mouth, now here's what happens. It dramatically limits mouth opening. Now, the logic behind this exercise is twofold. Number one, we are intentionally limiting the degree of mouth opening. And when we limit the range of motion, it's much easier to control it. It's easier to control against those deflections and deviations when we have a smaller range of motion. The second reason is because we're activating the tongue. When you activate the tongue by holding it on the roof of your mouth, there's a phenomenon similar to reciprocal inhibition. It's kind of the same idea, where some of the mastication muscles are allowed to relax. And when you have significant muscle imbalances side to side, where one side is, let's say, tighter, it seems to have an effect by allowing those tighter muscles to relax a little bit more, and it becomes easier to control that motion in the midline. And so this is really more of a neuromuscular type of exercise. I would build this as neuromuscular re-education because we're re-educating the person on how to actually control that in the midline. Now, if you do this exercise, tongue on the roof of the mouth, and you notice that they're still having a little bit of deviation or deflection, you need to make sure that they are looking at themselves very intently in a mirror and trying their best to voluntarily control that to make sure that it is not deviating out of the midline, okay? And I would usually have people start by doing this 15 repetitions, and when they get to the bottom, hold that for about 3 to 5 seconds, but make sure to do that in front of a mirror. The second exercise is called guided mouth opening. Now, guided mouth opening, we forget about the tongue. We don't do anything with the tongue. We are going to open the mouth as wide as we can. Now, we do have to mind pain, so if it is still very painful at end range, we might stop short of that. But the idea is we're going to use our thumbs to control the action of the mandible and keep it going in the midline. Again, you have to make sure you're looking in the mirror when you do this, otherwise you can't actually see your mandible. Okay? So let's suppose I have a situation where open my mouth and I don't want this. I want to keep it in the midline. So what I'm going to do is I'm going to put my thumbs right here on the mandible, and I'm going to open that same distance, but I'm going to control against that deflection. It'll look like this. Now, this thumb is probably going to have to do a little more work, but the idea is keep that mandible in the midline. And over time, you want to allow your thumb or thumbs to use less and less force, and your jaw muscles are doing more and more of the force. So this is more like an active assistive range of motion type of exercise. Maybe at first, the thumbs are providing maybe 75% of that control back to midline. Eventually, we want it to be maybe these are only contributing 25%, and then of course eventually 0, where the person can then just and keep that in the midline 100% voluntarily with their own muscles. So yes, we need to address specific impairments, loosen up the joint capsule, get other muscles to relax, strengthen around the jaw and the neck. However, we're doing the patient a disservice if we don't actually correct the movement, because you can have patients where all that stuff gets better and they don't have any pain, but they're still demonstrating little bits of a deflection or deviation. We want to make sure we correct that, because that will help to prevent or at least reduce the risk of recurrence of this in the future. So make sure, if you're not doing already, you are prescribing corrective exercises for the motion of that mandible when appropriate. Please make sure to like this video, subscribe to my channel, and hit that notification button for notifications for all videos in the future. Thank you so much.